What's up, guys? This is Brett from Soul Rebels, and today we have one of the most effective routines to fix lower back pain, and it's also a great way to prime the lumbo-pelvic hip complex prior to your training. But before we get started, please note that this video is strictly for entertainment purposes only and is not a direct treatment plan. So we've used these exercises in our practice to repair and recover from back injuries that had us out of training for over a year. And we continue to use them to prime our lumbopelvic hip complex for load-bearing exercises. So we're going to go over some stretches, dynamic movements, and mini band exercises that will help lengthen and strengthen the lumbopelvic hip complex, which will in turn alleviate pain and facilitate proper nerve function. So let's go ahead and get started. We are going to begin with the most regressed exercise, which is the posture reset position, where you lie on your back with your feet elevated on a bench, chair, or whatever you have around where your feet can be elevated, to where you're able to have your quads and calves at 90 degrees so that your back can be pressed flat against the floor, eliminating a low back arch. You can stay in this position for as long as you want. Just make sure it's longer than a minute to get some kind of relief. Here we have the child's pose position. This is a great low back, quads, hips, and lat stretch. You start in a kneeling position where you'll sit back on your heels and extend your arms out in front of you. You'll come up to your fingertips and walk them out and press them down to where your forehead almost kisses the floor. You'll stay in this position for 30 seconds before coming out of it gradually. To lengthen the spine even more, we progress into a hanging doorway stretch. You're going to need a towel or some kind of material that will protect your hands from pain while hanging on the door to allow for longer holds. From there, you're going to grip the open door and slightly bend your knees with your toes still touching the ground to allow for a gradual pull in the spine. To get more pull in the spine, you can bring your toes off the ground to allow gravity to do its job and decompress the spine even more. You can hang anywhere between 30 seconds to 5 minutes. For those of you who have experience in decompressing the spine and want to substitute the previous stretches and allow for better relief and nerve function, inversion therapy is the next level. Start by securing yourself in the apparatus, and from here you'll use the device at your own discretion, or per your physicians. I would start gradually and play with the inversion degrees and work your way up to full inversion if you're able to. It's recommended to not hang longer than 5 minutes at a time, and I would suggest again starting on the low end and hanging with 30 seconds and working your way up to 5 minutes. One important stretch that should be added to every training practice is the piriformis stretch. This stretch lengthens a small muscle just below the tailbone where the sciatic nerve bundle runs just beneath it. First, start by lying on your back and crossing one ankle over the opposite knee. You'll then thread the needle between your legs and pull your knee to your chest while using your elbow to push on the knee away from your body to lengthen the area. Do this stretch on both sides for 30 seconds. Now that we have lengthened the lumbopelvic hip complex and lower back, we're now going to position our lower vertebrae into place by completing the Sphinx or Cobra stretch depending on your level of experience and flexibility. Start by lying on your stomach with your elbows to your side and hands at chest level. You'll then begin to look up towards the ceiling, pinning your shoulder blades back, squeezing your glutes, and activating your core. And then if you decide to do the Cobra, your elbows will come off the ground and you'll be in a fully extended position. Again, you will hold the position for 30 seconds. Okay, from here, we'll work on some dynamic movements that will activate or strengthen those muscles that we have just stretched and hold everything into position. We'll first do Supermans. You'll lie on your stomach and extend your arms and legs out, and lift them off the ground, squeezing your glutes and activating your lower lumbar and flying left and right for 10 reps. Up next, we're going to do Supermans with mini band abduction. We're going to use a mini band to strengthen the glute muscle and hip complex just below the lower lumbar. Place a mini band just above your knees, lie on your stomach, and just like the Supermans, extend your arms and legs, squeezing your glutes to protect and activate your lower lumbar, and complete 10 reps of leg abductions. So we're going to do mini band side to sides, which are abductions, and mini band step backs, which are hip external rotations. We'll then stand up and place the mini band just above our ankles. We'll do 20 reps of side-by-side alternating abductions, and then we'll do 20 reps of alternating hip external rotations, and these exercises will have activated and strengthened the hip and glute complex to support the lower back. All right, guys, that concludes our video for today. This was the most effective routine to fix lower back pain and is also a great way to prime the lumbopelvic hip complex prior to training. So until then, this is Brett. This is Soul Rebels. Don't forget to subscribe and like this video. And until next time, you guys take care of yourselves. Peace.